The risks with a standard wheelchair are, first, the initial transfer. The second would be getting them to the vehicle. And third would be being transported in the vehicle. So when you got to get a patient from a hospital bed or from a seated position into the wheelchair, the liability happens there because you don't know what clinical need the patient has. You don't know how long they've been in the hospital bed, you don't know what level of assistance they need, and even if you do know what level of assistance you need, does the provider have the training, do they have the confidence to properly transfer that patient? With the initial transfer, your risk is that the patient's going to fall. Then we have getting them to the vehicle, which can be a risk and hazard depending on the patient's ability to hold themselves upright and what's going on with the patient. I've seen patients where they hit something along the way, like a transition or something, and I've seen them fall out of the wheelchairs because all of a sudden they couldn't hold themselves up and they hit something that propelled them forward. Definitely once they're in the vehicle, you have the risk of just normal driving condition. You have accelerating, you have braking, you have turning. All those things in the back of a vehicle for a patient that has no trunk control can be very difficult. So with the no-lift NEMT solution, we can provide the lateral transfer for them, reducing that transfer risk. We can put them in the seated position, and we can tilt them or recline them back, letting gravity pull them back into the chair, opposed to being pulled forward out of the chair potentially. We can then secure them in the vehicle with designated attachment points that are part of WC19. Normal turning, braking, accelerating isn't going to affect them as much because they're not using trunk control to hold themselves up in a wheelchair. They're sitting back and reclining in a chair to where they're not using that energy to hold themselves up. And then of course, if there was an accident with a crash tested chair and the no-lift NEMT solution, you're giving the patients the best chance they have if there ever is an accident.